Welcome to all. My name is Magdalena Moreno, and I'm coming to you from the unceded land of the Bunurong, and Wurundjeri Woi-wurrung people of the Eastern Kulin Nation. And I'd like to pay my respects to their elders, past, present, and emerging. I'll also like to acknowledge and thank all those First Nations peoples that are joining us here today. I'm the Executive Director of the International Federation of Arts Councils and Culture Agencies, known as IFICA. I want to thank the Australia Council for this important program series on arts, creativity, and mental well-being, and congratulate them on their pace, participatory and multifold methodology to bring health and arts into closer dialogue. The conversations of this series have centered on a range of key issues, predominantly in the Australian context. So now let's hear from experts and colleagues around the world to tackle these very issues, look at natural roadblocks, and most importantly, the opportunities to come together. Allow me to introduce you to our international speakers for today. Daisy Fancourt, Associate Professor of Psychobiology and Epidemiology at the University of College London, and Sunil Iyengar, Director of Office of Research and Analysis at the National Endowment for the Arts in the United States. It is a true honor to have you both here today to bring the intersections of health and the arts perspectives together, and also with your breadth and depth of knowledge in science, evidence base, and public policy expertise, which is truly fantastic for this discussion. So let's start with you, Daisy, and then I'll ask you the same question, Sunil, afterwards. Could you tell us a little bit about your research in arts and health and well-being and the perspective that you bring, that mental health perspective, into this dialogue, and talk to us about your background? And then Sunil will ask you the same, coming from the arts and arts research perspective. Over to you, Daisy.
Thank you so much, and it's a pleasure to be involved today. So I head the Social Biobehavioral Research Group at UCL. And this is a team of over 20 fantastic researchers who all focus on the effects of social factors on health, including social deficits like loneliness or isolation, and social assets like engaging in arts and culture, amongst other activities. And we're really interested to find out, how do these social behaviours affect our health? What are the mechanisms of action that drive this? Do some people benefit more than others? And can we help to increase people's arts and cultural engagement? So we've got 4 main programmes of work. We design and evaluate new interventions with clinical trials and implementation science studies, specifically trying to use the arts to solve clinical problems. We also have an epidemiology work stream where we use big data and cohort studies to look at the population level and long-term effects of arts engagement on our health. We have a behavioural science work stream where we understand and explore human behaviours and how the arts are patterned sociodemographically and how we can change those behaviours. And we also have a complexity science work stream where we try to understand what the ingredients, mechanisms, moderators of all of these effects are, using complex theories from lots of different disciplines. So I come at this very much from a scientific perspective, but in collaboration with dozens, hundreds of artists and arts organisations, and a very multidisciplinary team.
That is very exciting to hear. And now, from the other perspective, Sunil, over to you.
Thank you very much, Magdalena. And it's great to be here with Daisy. I have to say, just before I begin, that Daisy Fancourt is also thankfully working from the University College London with one of the NEA research labs, which is at the University of Florida. It's the Center for Arts and Medicine, and they have a lab called EpiArts Lab. I encourage you all to check it out online. Their goal is to analyze longitudinal data sets in the US to understand the relationship between arts variables and public health outcomes. And I have to say, the way it's been, they've already published some papers from it, and the way it's gone so far is a lot of that work has really been built not only from a quantitative standpoint, quantitative research standpoint, but truly engaging with, as Daisy said, with artists, arts organizations, cultural practitioners, to understand what's worth studying and how to kind of frame the results of what they learn, particularly with an equity lens. So the National Endowment for the Arts in the United States is the largest public funder of the arts in the US that covers all the 50 states and all the US territories in terms of reach. What we do as an agency writ large is to promote equitable opportunities for arts participation across the country and support the arts sector that way. But, what my background, just a brief the detour here, is, about 10 years before I joined, or for 10 years prior to my joining the National Endowment for the Arts as a research director, I was a journalist covering healthcare policy and biomedical research. And in fact, looking at pharmaceutical industry, biotech. And I was always taken by, I sat in innumerable panels, scientific panel discussions and policy discussions around efficacy, improving and building evidence for interventions. And as many of you know, the gold standard is sort of randomized controlled studies. And so, when I came to the National Endowment for the Arts, part of me really wanted to see how far we could go with that approach in the arts itself, looking at a host of outcomes, but particularly in health and well-being. So we have, in fact, supported many of those small scale, admittedly, kinds of studies through a research grants program we've launched, research grants in the arts, as well as the NEA Research Labs program, which I mentioned. Not all of them are RCTs, as it's called, but using a variety of different research methodologies. And over the years, what we've seen, I know we're going to get into this, but just in terms of how this fits with my background, what I've been able to do is, as in terms of managing that portfolio, we've also kind of expanded more into public health. So we can talk about that later, but not just looking at therapeutic applications of the arts, but in fact, understanding from a more holistic, comprehensive perspective, public health and outcomes that relate to well-being and emotional well-being and social and emotional wellness as well. So that's something we've invested in. And I would just cite two programs here in closing. One is we have something called the Sound Health Network, which is an online resource and networking center. They also do convenings based at the University of California, San Francisco. And it grew out of a partnership that the NEA has with the National Institutes of Health to understand specifically music and health, and also the neuroscientific underpinnings of music and some of those health outcomes, the mechanisms of action Daisy was referring to. So that's a resource center we currently support. We also support the something called Creative Forces, which, getting back to therapeutic applications, is in fact working with military populations and veterans to integrate the arts in what's called creative arts therapy, really in therapies, including what's called creative arts therapies to combat post-traumatic stress and related psychological illnesses and other traumas, in fact. So those are two programs. And I'll just say that our strategic plan, the NEA's strategic plan, now has enshrined in it this objective to use the arts to help use the arts to advance health outcomes, both in terms of individual outcomes and also community-wide healing.
Thank you very much, Sunil. That's really fascinating. And I guess a few things come up as I'm listening to you both. The passion that you both talk about it, whether you're coming from a health perspective and engaging with the arts, whether you're talking about coming from an arts perspective and really looking at what that public health and sort of kind of broader and holistic approach to what health and the arts can do and creativity together, which, as I understand, is obviously at the heart of what this project at the Australia Council series is attempting to achieve. Daisy, to you, and I want to make a special note to the tremendous work you did for the World Health Organization, the scoping review titled, What is the Evidence? What is the evidence on the role of the arts in improving health and well-being from 2019? Have you seen a shift in the receptiveness in terms of the role of the arts in the work that you're doing? And particularly if we connect it to those public health outcomes, both at the individual or collective, as Sunil was mentioning?
Absolutely. I feel like the last 10 years has been such a phenomenal change in the way that this topic is being received across different stakeholder groups. As an example, with the World Health Organization, 10 years ago, this topic wasn't really being explored very much at all. Whereas now we're at the position where not only have we published a report from WHO on the evidence base that you just mentioned, but also a series of policy briefings. WHO has designated my research team as the WHO Collaborating Centre for Arts and Health. So we've now joined an international network of other collaborating centres focusing on core topics relating to global health outcomes. So we're really seeing a huge policy shift at this international level, but also at specific country levels. We're seeing so many more countries where they've got policy involvement from arts and health working collaboratively together now. And actually, as part of our WHO Centre, we're currently doing an international policy mapping activity where we're identifying the different policies that are being developed in different countries so that we can start to see how countries can learn from one another and start to develop their own policies further. And I think also we've seen a real change from health professionals. We've started to see more and more health professionals encouraging their patients to get involved in programs, requesting arts programs to meet their clinical challenges. We're seeing more and more arts on prescription happening in the UK and a number of other countries internationally. We're actually seeing direct commissioning of arts services from within healthcare budgets with this recognition that the arts can be incredibly powerful in solving health challenges. And then from a research perspective, something I've really noticed is that there are more and more research grants open on this topic, and it's particularly larger scale grants that are enabling us to do these kinds of randomized control trials or other larger scale or international projects that Sunil mentioned before. And in addition to that, I've also seen that there are more and more researchers wanting to move into this space. I've got many more PhD students applying, particularly students who come often not at all from arts backgrounds, but have come from quite core scientific or medical backgrounds, who are really desperate to focus on this topic because they're seeing its relevance to the way that public health and medicine are moving. So I really do feel we're at a very exciting time for how this topic is developing.
Fantastic, thank you for that. And I'm sure that, your scoping review happened before COVID. I can only imagine that since or post-pandemic, you're seeing a further increase.
I think what the pandemic has been very interesting for is it's highlighted how important the arts are for people's health. I mean, when the pandemic started, we all saw those viral videos of people singing from their balconies in Italy as lockdowns came in, people in England painting rainbows for the National Health Service. We saw this proliferation of arts craft sales in the US from people being at home. So we actually saw people valuing the arts at a time of national crisis, global crisis. And this is really interesting because one of the arguments that I've heard over the last few years is, well, I understand the point of the arts as a cherry on the top of a cake. When everything's working nicely in a health system, the arts can add extra benefits. But I've heard this argument of, well, but when you've got a real crisis, what you need is straight medicine. And it's like, well, actually, when we have a real crisis, we realize how complex the problem is and that you need to still have multiple different approaches. And the way that the arts have been used to help people cope psychologically for their mental health and well-being, the way they've been used to connect people, reduce loneliness, encourage social cohesion, the way they've been used in health communication during COVID as a way of translating and communicating critical health messages. All of these things have been absolutely fundamental to the way that the world has responded. And I think it's wonderful to see that appreciation coming through for that broad role that the arts can play, even when things are really bad.
Thank you, Daisy. And yes, that certainly talks to what you speak a lot about, the social determinants, which is also part of the discussion paper that the Australia Council put out as part of this program. So Sunil, for you, how do you see, have there been shifts in terms of?
Yeah, thanks. Well, so I mentioned the National Institutes of Health, which is, the world's largest really funder of biomedical and behavioral research. And they, as in recent years, have been much more open, and I would say, and receptive in terms of the leadership to understanding, for example, music and even movement and dance, and understanding different art forms and how they can correspond with health outcomes. And they're, of course, very interested in the sort of biomechanism way of understanding what's really happening here. What are the biomarkers making, that by which we can detect these changes, and looking for really, I guess we would consider them hard endpoints, measurable outcomes, but also really use, in a way that I think is often a little bit beyond the ken of your arts and health practitioner, right? I mean, in many cases, it really requires transdisciplinary teams of researchers who are willing to, and as Daisy said, with funding to invest over a long term. And so I don't think we're quite there yet in the US. I think there's definitely some movement there, and I'm not pointing only to National Institutes of Health, but other funders, particularly those of research in medical science, to start opening the aperture a bit and understanding how they can study. Particularly, one of the challenges in this country is I don't think there's much of a dialogue with the payers, the sort of reimbursement of healthcare, insurance companies and those who set policy for insurance companies. There's not quite that dialogue that there should be to determine cost effectiveness of these therapies or interventions, or if you'd like to call them programs. But I will say this, on the other hand, there's more of a grassroots effort, particularly around looking over the Atlantic to what's going on with social prescribing, And the idea of, and there have been some places in the US, to my surprise, that have really, even at a regional level, done some pilot programs and demonstration projects to understand whether allowing physicians to refer or have setting up a system whereby physicians can refer patients or people who come in to certain arts and cultural services alongside maybe gardening or other activities. And that, I won't say that's kind of like wildfire, but it's it's certainly there in some pockets of the US. And I think that looking, we do look a lot of times to what's going on in other countries because there's a lot of, I think in some ways, the landscape, there's more progressive outlooks toward supporting this work more holistically. But in the US, one thing I will say is, apart from still trying to raise the quality of evidence so that it lands on the desks of people who can make decisions about payment and healthcare strategies, I think one of the things that I am seeing, getting back to the grassroots movement idea, is a lot of interest in understanding how the arts can, as Daisy was implying, build social cohesion at a community level. So that has been doing really well, I think, in the US. A lot of communities, particularly through programs like, and it's not just us, but the National Endowment for the Arts has a program called Our Town, which is what's called creative placemaking, where it's really getting communities to, aspire towards some collective action and integrating arts and design in the process. We've seen a lot of work where communities are in fact taking upon themselves to work with municipal leaders and et cetera, to create more healthy outcomes through coming up with metrics and systems and strategies in particular locations to build in arts and health services, integrate them better. So that's been happening a lot. And I think that's a crucial piece of the puzzle when we talk about equity, because the arts have a real role in, as you know, Magdalena, in fostering equity and in improving the climate of diversity, equity, and inclusion and accessibility in the US. And so one of the things I'll just end on here is a few years ago, we teamed, right before the pandemic, in fact, we teamed up with the Robert Wood Johnson Foundation and other funders, Kresge Foundation and others in the US, to commission a report that was produced called We Making, W-E, and it's essentially laying out a strategy and a conceptual framework and case studies illustrating how the arts can be used to improve social cohesion, but en route to enriching healthcare outcomes, and particularly health equity. So really with a health equity focus and empowering communities to have agency to advocate for their healthcare and to actually, ask the right questions and to connect with the healthcare community.
Thank you, Sunil, and thank you, Daisy. You're creating a roadmap that sounds really exciting, that endless possibilities in terms of collaboration, but we know that everything's not picture perfect. So let's maybe unpick a little bit what those roadblocks are, the walls that you're having to face, the types of conversations that you seem to forever be having to have, and that it's very difficult to get past that invisible or visible wall, I guess. So maybe Daisy, over to you. Where are you seeing resistance? Where are you seeing those where do you think the dialogue needs to shift?
I feel like there are two things that I keep noticing coming up over the last few years, one of which is, what are we talking about? And the other one is, how do we measure it? And with regards to that first one, I think what people have wondered for a long time is, what is it about the arts? When we say the arts, what do we mean? And are we saying that there's a difference between different types of art forms? If we're prescribing somebody singing versus painting, then are there differences? And what about things like gardening, like Sunil mentioned? Is that an art form? Does that matter? And I think this has been a really big issue, is what are we saying? Is there something magical about the arts, or are they just another intervention that we can offer? And we've done a lot of work on this within my team. And in fact, we published a paper a couple of months ago, which is really designed to try and unpick this issue. And this has been starting to use the language of active ingredients. Now, this has been used in pharmacological research for decades. We talk about what are the ingredients of a drug that mean that they lead to effects on our health. But we've seen this concept, this metaphor, I guess, applied across other domains as well. It's become increasingly common in behavioral science and implementation science. And we thought this was really important to start grappling with in arts and health, because if we can actually say what are the ingredients of the arts, then this means we can start to say what the overlap are between, for example, singing, painting, gardening. And we can also start to say what the overlap is between the arts themselves, and other interventions like cognitive behavioral therapy or exercise programs. So we've recently published a framework called the Innate Framework, which is about what are the ingredients in arts and health interventions. And we've identified about 140 different ingredients, which are to do with the project itself. So actually, what are you doing? What are the resources involved? How do people spend their time? What's the dose, the frequency they're engaging? It's also about the people. So what's the leadership model? Are there other people involved? What's the social diversity? These kinds of social ingredients that could start to affect you. And then also, what's the context? How are you engaging in this? Where? What role is place and time having? And we've tried to develop this for arts and health professionals as well as for researchers. So there are worksheets that organizations can fill in. It's got simple tables that actually start to map out what your ingredients are. And the aim here is that we can start to have a much better language for communicating what we're talking about. And we're really hoping this will help with commissioning, help with healthcare professionals as well. It means that we're starting to incorporate more of that health language and dialogue into arts and health practice. And it means that we've actually got much more specific ways as well of recording interventions in clinical trials and saying this is actually what people received if you want to replicate it. And then the other issue I mentioned was about how we measure things. And I think this is a real challenge because every stakeholder often wants a different type of evidence. And this has been a big issue in terms of study design, those debates over randomized control trials versus other approaches, versus self-reported outcomes versus these objective markers that you heard Sunil mentioning, versus these qualitative versus quantitative data. And I think this has really been a challenge for the field as a whole, because in the end, what's often happened is people have picked one approach, often that meets the disciplinary backgrounds of the researchers involved. And sometimes this meets one or two stakeholder group needs, but it's quite rare that it meets all of them. Yeah. And I think what we're seeing more of, and I think what we need to see even more of, is an increasing interdisciplinarity in every research team that's working on arts and health projects so that we can have a diversity of outcome measures. We're seeing this approach in a lot of other domains outside of the arts, so lots of other health domains. They're really encouraging what they call outcome-wide analyses. So analyses that look at lots and lots of different outcomes, spanning lots of different domains, psychological, social, behavioral, biological, etc. And I think we need to have more of this. I also think we need more of these complex research designs that involve randomized control trials, if and when they're appropriate, alongside qualitative methods, alongside implementation science and process evaluations. Now, of course, this is complex though, because it means that you're starting to have studies that have got different layers, that need bigger teams involved and therefore need more research funding. And then that's where you start to get this kind of challenge of, if you don't have enough money, what do you scale back? And then which stakeholder groups are you going to be missing out as a result of that scale back? And I think that's a huge challenge for the field. And really, I think it's important for funders and commissioners to realize the importance of properly funding these studies, because when you properly fund them, what you get out of them is so much more valuable and more rewarding and much more likely to lead to the kind of sustainable change and long-term implementation of projects that the whole field really wants to see.
Thanks, Daisy. Before I hand over to Sunil, I just wanted to ask you something in regards to the question of what do we mean by engaging with the arts? And I guess in that, when you're trying to analyze or unpick what that means, and we do not underestimate how complex that is, because in the arts and cultural policy space, it is complex for us to really unpick it. And there's so much cultural nuance connected to that as well, in terms of what arts and culture means in one context or another. But I wanted to ask you in relation to how you find those answers and the role of the arts, the artists, the practitioners, the sector. How do they engage in that methodology to help you, I guess, solve that or get to that result? What's the level of engagement, if I can quickly ask you that?
It's a really important question. And of course, one thing we've been very clear on in our work on ingredients is we're not trying to reduce the arts down to 140 components. It's the opposite of that. Instead, what we're trying to do is to broaden our language so that instead of saying, oh, the arts contains, we've seen papers where they've said there are 6 key components to the arts activities. It's like, no, there aren't. There are way more than that. And we're also trying to actually nail down the importance of things like the atmosphere. Often the atmosphere of arts activities can be really welcoming. It can be a safe space. Now, these aren't flippant things. They're really crucial ingredients that could actually make the difference between whether someone who's feeling depressed or anxious actually starts to benefit from the activity they're doing. So we're encouraging a pragmatic approach where we're not saying this is every part of a project ticked off into nice little boxes, but we are saying broaden how you're thinking about this, talk about this in a really rich way as opposed to an overly reductive way, and also appreciate some of those, like I said, sort of ephemeral qualities that the arts can bring that can be different from, for example, medical interventions and can help contribute to their effects on health.
Magdalena, I think what Daisy is saying is so important, and it also underlines why this is such a complex and complicated and challenging. We welcome the challenge, but very difficult field because, arts participation is so context dependent, and these active ingredients, as she was using that metaphor, and I was thinking of recombinant DNA and, sort of how there's so many different variations and permutations one could talk about. And can you study every single one of them? And if so, how do you create a way to, it can be overwhelming, but creating a schematic where people can really try to target the appropriate so-called active ingredient with the right study design, or, and for the right end. Like, you don't need to do RCTs for everything. I will just say that in the US, I've seen, to make it a little bit simplistic here, a schism in a way between, and I think it's getting better, but there's this kind of creative arts therapy, to say music therapy, dance therapy, art therapy, drama therapy, where it's, it's really about, it's certified, there's a certification process and there's training, and it's a discrete kind of almost, an adjunct or a part of, psychological therapy, various behavioral therapies. And it's in fact, very different in some ways from what we kind of loosely refer to as arts and health programs or interventions. And I'm talking here about interventions, not so much manifestations of well-being that arise from engaging with the arts. I'm talking about the actual programs and just finding that, what's the so-called intervention or program you're going to study. So the arts and health kind of world, if you will, is, it may not be therapeutic, it may not be targeting a therapeutic outcome, as we were discussing. It may be about, alleviating or reducing or symptom management, or something that's even less defined sometimes. And that too is very valid and has its role, especially when we talk about some of the values of that. I was hearing Daisy talk about some of the factors, and one thing that's rampant throughout all this a lot of times is socialization. I can say we've done multiple surveys of arts participation where we've come up with constructs to measure how people engage with the arts throughout their lives. And we've done these surveys with the Census Bureau, for example. And we find consistently that the primary motivation for many people to engage with the arts is to be with other people, particularly with family and friends. And so when people are deprived of that opportunity, even if the arts aren't the only way you can be with other people, it's a major way. And that we've seen that's a big barrier too. If you don't have that people to go with or to be with, people don't engage in the arts as much. So, I think there's something there we need to understand better. So especially if you want to claim unique benefits for the arts, or at least we don't have to say that it's, I think it's important to integrate it with other factors, but I think it's also important to disentangle a little bit arts, the active ingredients, as they maybe outside of socialization and also in terms of socialization. And that's something I think there could be more research about, particularly when you compare, as Daisy was saying, with other types of programs and interventions.
Thank you, Sunil. Thank you, Daisy. This notion of active ingredients, I find it really fascinating. I guess as someone with an arts background, I think of active ingredients are those things that stimulate you, that inspire you, that challenge you when you experience an artwork. So maybe interpret it a little bit differently, just in terms of my own experience when I'm immersed in the arts, but definitely I would say there's plenty of active ingredients in the arts, and the connections that you're both, and very valid points around the need to measure, to make evidence, to provide evidence, which will then hopefully impact positively in new policy developments. So I guess let's talk about how this, recognizing that, Daisy, you're talking about working with the WHO and looking at the international context. Sunil, you're talking about the national context. So how can you develop policy with all these different stakeholder groups? You've already explained how complex the environment is. What would be some of the recommendations or advice that you would give to those that are listening to us today that have that challenge and want to get a sense of how they can see a little bit of a horizon heading towards that direction. A little bit of advice from both of your ends. Daisy, start with you.
So we're hoping that the policy map that we've been developing, that we'll be launching later this year, might help to provide that inspiration. So if there are countries where they don't yet really have any policy on arts and health, they'll be able to look at the map and find some countries that have put in some of the kind of basic or early stage policy work, either in arts or health or across those sectors. And they might be able to use this almost as a template to work with their own governments to develop similar work. Similarly, countries where they're further ahead in terms of their policy development might be able to be inspired by other directions that have been taken in other countries and actually be able to start thinking critically how they could expand their own work instead. But I also know that lots of people are working more at grassroots levels where actually there's still a huge opportunity to do things locally. And I think I've always had this view that we shouldn't necessarily wait for the top down to come. We can work bottom up as well. So I think anything, even if it's happening at local levels, that can be actually supporting the development of this field is really important. But it's even more important that people share what they actually do, because I think that the international learning from that could be hugely valuable.
Well, before just to riff on what Daisy said, I do agree that there are a lot of resources out there that people don't have to invent this from scratch. Okay, admittedly, we could do with more standardization and a lexicon, a clearer lexicon of terms and some of those things, but there are models out there. So I mentioned the University of Florida Center for Arts and Medicine, but there's also an effort underway at Johns Hopkins University and Aspen Institute called NeuroArts, which is also trying to build a kind of cohesive framework for discussing arts and health. And there may be some products out of that are valuable. Certainly, there's also an effort in the US to develop common core outcomes around public health and the arts. So that's an effort worth watching. And I would just point out to things like, the small but mighty state of Rhode Island in the US has a really nice kind of arts and health program at the state level that they've developed. And I don't think they're alone. And, just a little, also in the East Coast happens to be in the US, the Massachusetts Cultural Council has been doing some really interesting work in this area. So there are some pockets, again, in the US worth following and models such as what Daisy was referring to. And I'm looking forward to seeing that map, policy map. I think those are really useful guidance documents and tools. One thing quickly, before I describe Sound Health Network, is we've tried to, in our research portfolio, and particularly in our new research agenda, which just came out, a 5-year research agenda, to incentivize community-based participatory research as a way of really, to your point, Magdalena, you're asking how do artists and how do arts organizations involved in this work? Well, I think they have to be and should be. A lot of times what happens is the researchers, we fund academic researchers, and they may not include artists on the team or arts researchers, artists or arts professionals. But I think it's important to incentivize, and we've tried to incentivize collaborations with arts organizations and artists. I do think that it's important to continue to do that, but also community members where healthcare, where arts and health projects are occurring, and trying to get them involved in the study design, in the actual interpretation of results, et cetera. So Sound Health Network is a resource, a national resource center we've set up that is intended to promulgate, and it does, research and evidence and catalyze discussions through webinars and convenings about music and health. And they have an online clearinghouse of publications. They have a directory. You can kind of mix and you can kind of find people to connect with there, and a virtual networking platform if you're interested in really worldwide, if you're doing work in music and health at that intersection. So that's one resource we have that I hope will pick up in the coming years.
Now, there's so many more questions, but we are going to have to wrap it up. And I just wanted to ask you both one question, and a disclaimer that I've poached or stolen this idea from a friend of mine in Argentina. Whenever I get asked to moderate, I always like to ask, particularly when there's two speakers, to walk in the other's shoes. And the question, neither Sunil or Daisy know what I'm going to ask them, but this time I'm going to start with you, Sunil. If you were Daisy Fancourt, what would you tell your arts sector colleagues about the value of working in health?
Well, I would point out that epidemiology may seem a field of practice that's as dissociated from the arts as you can imagine. And yet, through rigorous research, we've been able to see that there are clear and really tangible benefits associated over the long term with people's engagement in the arts in a variety of ways, and correspondingly a wide variety of outcomes. I don't think just to be honest, I don't think I could ever say it better than Daisy does herself. But honestly, if I were, that's the core message of what I think arts organizations need to know, that they are part of the solution, that their work, they may not view themselves as health professionals, and certainly we can't certify them or give them diplomas for that, but they're clearly contributing to more healthy ecosystem. And moreover, they're doing work at this tremendously valuable cross-sectoral space, which is the future, I think, of the arts in many respects, and also of societal transformation. I mean, I think we need to have equity. Some of the great work that artists do to engage communities and to enrich lives has to be measured and computed as part of the overall kind of calculus of well-being in for all these countries. And I think it's important to enrich, therefore, the arts sector, and to give them the tools to make that kind of catalytic kind of contribution.
Well, thank you, Sunil. And now over to you, Daisy. If you were Sunil Iyengar, what would you tell your colleagues in health about the value of working with artists?
I would say that the health challenges that we are facing now are increasingly extraordinarily complex. And we're realizing just how multifaceted every health problem and health condition is. Artists are arguably the most creative people on this planet. So I would be saying to health, you need artists to help you to solve these problems. The wealth of expertise and the huge creative skill that these artists have is something that we need to be bringing into health in every possible way. There's sometimes this view that artists in the arts sector are trying to break into health, but it's the opposite. Health should be desperately grabbing artists and arts organizations wherever they are and getting them involved to solve these problems.
Well, thank you, Daisy. There's so much more that we could discuss, but we have to end here. I want to thank you both, our esteemed speakers, for your time and your generosity, your spirit and your passion. To all of our audiences, arts, health sector representatives, policymakers, arts and health practitioners, researchers, and all those who tuned in, I trust we have provided you some further insights for reflection and deliberation in the important reaching your conclusions around actionable ideas that bring together creativity, arts, mental health, mental well-being closer together. We'll leave you now, and thank you all for your time. And thank you, Sunil and Daisy.
Thank you so much.
Thank you.